Well, myself, Dr. G.S. Jammu, and today I have one of my patients who recently came from Kenya. He's Mr. Deep Jana, he's sitting right next to me, and he's undergone mini gastric bypass. I understand, I think 5 days back, Deep Jana?
Yes.
So, first of all, I would like to know, how did you come to know about this surgery we are doing in Punjab, especially Jalandhar in a hospital? How did you come to know about the setup and about me from Kenya?
We have a family friend who had actually come to your clinic about 2 years ago. Her name is Amrit.
Okay.
And the company she works for, we also do some work for the same like Jalona de Mondea.
Yes.
And I actually got approached by them if I was really interested in getting this done. And they referred me to her.
Okay.
And we got talking. I actually remember she was very open arms and told me to get to Bariatric.
So it was a word of mouth that someone convinced you in Nairobi, one of our old patients, and so you got convinced and you came to the surgery.
Exactly, because one, she's been a long family friend. She knows our family. Our families are known to each other.
Okay.
And then I didn't even know she had ever got it done. But when I did find out, and she told me, "Come, let me brief you on this."
So is this have you been to India ever before this surgery?
No, first time. First time in India.
He's born in Kenya and this is the first time he has flown to India for the surgery. And were you skeptical about this surgery that you are visiting India for the first time, and were you afraid of anything about the surgery or about India, and are you afraid still now?
Before speaking with Amit about the surgery, yes, I was a bit skeptical. This is something I've been thinking about for the last 1.5 years. But then when I got to speak to her and after that, and I was just full of confidence and everything has just worked like clockwork. My greatest experience here was to land in Amritsar, and I felt it was a big honor to at least visit the Golden Temple. I feel very lucky that I got that, and after that, everything just started to fall in place. I kept, as every step I took forward, I kept on getting more and more comfortable that I'm within my own people. Right from the time we got received at the hospital, from the guards outside to the staff, to the doctor and everybody, it's just been superb so far.
And so like this gentleman, he came to India for the first time, and it was our duty, so we picked him right from the Amritsar airport to our hospital, and he visited Golden Temple before that. And are you happy the way everything went off, like from Nairobi onwards, from Kenya onwards, till the journey to Jammu Hospital, and tomorrow you're leaving back just after 6 days of your surgery, and I think you have lost about 6 kgs in 6 days after the surgery.
Yeah, that's
so
true.
what message you want to give to the other Kenyans, especially who have not come to India and are skeptical about getting a surgery, this weight loss surgery done in India? What message you want to send to those people?
The message I really want to send to the people out there is, one, come to terms with the condition you are in. If you need the help, ask. You will get the guidance, and definitely the result will show eventually in me. But already I am walking away 6 kilos lighter than when I came. So I would say go for it.
And can you please tell your phone number, so if anyone from the Kenya wants to contact you, so you want to have some queries about the surgery, about the setup, and you answer the queries, can you please speak your number so you can be contacted in Kenya?
Yeah, my phone number will be +254 720 480 000. That is my mobile phone.
And
or they can get me on my email, which is deepchana, that is DEEPCHANA 22@gmail.com.
so did you hear from anyone that after the surgery there's not many things you cannot eat, and what is your experience in reality after 6 days of surgery? When did you start taking water and juices, and how many hours after the surgery you were put on liquid diet?
Immediately, I think within the 24 hours, I was.
Yeah, this is exactly. We put the patient on oral liquid diet just after a few hours, maybe 8 to 10 hours, as soon as the patient is active enough to walk about we put the patient on the oral liquid diet, and within 1 week's time, the patient starts the even solid diet, soft solid diet.
Yes, that is true. We started having like some soft lentils yesterday. So it's all in moderation. You are introducing this food slowly to your body. There's really no side effects. You will eventually go back to eating whatever you want. It's only you're going to be in a controlled environment. So don't be scared that you feel like, no, it's the end of it, I'll not eat this, I'm never going to eat this or whatever. No, you're just giving your system a couple of months to get used to it, and as how your body reacts to your changes is when your demand will start to come around again.
And tell me very frankly, is the surgery painful or stressful?
Not really. I didn't even feel it. Honestly, we landed at Saturday morning. We did the tests, the vitals, at 2:30 I was in the surgery. The next morning I was back in the ward and I didn't even know. And on Monday by evening, you had discharged me. You told me you're free to go home, and I looked at you like, are you sure? Like, yeah. Because I remember immediately by the next day I had to walk. We started walking. I felt no discomfort with that. Besides just a little bit, like because of the muscle or whatever. But nothing that you can say that you're going to say like, no, that's it, I can't do it, I'm not going to walk. No, it's fine, there's no pain. I think the most painful thing for me was the picking of the needles.
So, can you tell anyone who's not an Indian and wants to come to India for the surgery, what message you want to tell them so that they don't have any fears of coming to this setup of Jammu Hospital or to us? And can you clear their doubts? So everyone is skeptical, I know, about the surgery, and especially who was not person like who has never visited India. They have so many doubts in it about India or their Indian setups.
Mainly I've seen it's all the impression that goes on hearsay and what people see on TV. We have one of the biggest search engines if you're an IT person. Go on to Google, type in your need, and you will get your guidance. And I don't think so there's anything to regret about this thing. It's definitely, I would actually say, for the people who are scared of exercises and whatever, and who do really need the help with their weight control and just about dealing with other illnesses that are weight related, I must say, touch wood, I'm really lucky. No such illness is just an issue with my weight. And I don't even regret, even for a single second, that I came out all this far. I'm actually already, like I said, it's my 6th day here, I'm feeling better.
So this is the message we want the other people to carry out. That this surgery, you don't have to be scared for anything. As a matter of fact, if you're medically fit and physically you are unfit because of your this obesity increasing, and you have other problems like diabetes or high cholesterol, joint pains or snoring, this surgery can help you a lot, and it can really increase your life expectancy and give you good quality of life. And the other thing about the diet after the surgery is you can eat anything and everything. The main difference is that you have to take a little lesser quantity of food, because you get food with even lesser volume of food, and you are advised to take high protein diet that includes even the poultry like eggs, fish and chicken. And even Indian diet is good enough. We advise the good Mediterranean type of diet, which includes high fiber like salad and fruit, and a high protein diet. So, anything to say more, or should we say goodbye?
No, before we say goodbye, before I came out here, somebody told me that when you do this for yourself, you will really bless yourself. And I believe I did that. I did bless myself. I do feel a lot more active, more positive with life now. And definitely don't think twice about it. If you are thinking about it, go ahead. I'll tell you the same thing what I was told. You will bless yourself.
So he is no more my patient. I think we are friends now. And this gentleman has promised to send some patient from Kenya. I think we
I probably want to also see you there in Kenya, so let the people see you in person.
Yeah, sure. Look forward for that. Okay, goodbye.
Thank you.